This presentation is designed to help food establishments in King County, Washington understand the food establishment COVID-19 operational requirements during Phase 2 and 3 as directed under Governor Jay Inslee's Safe Start directives. Governor Jay Inslee, in collaboration with the Washington State Department of Health, has established a data-driven approach to reopen Washington and modify physical distancing measures while minimizing the health impacts of COVID-19. This approach reduces the risk of COVID-19 to Washington's most vulnerable populations and preserves capacity in our healthcare system while safely opening up businesses and resuming gatherings, travel, shopping, and recreation. For more information on Jay Inslee's directives, visit this website. COVID-19, also known as novel coronavirus, is a new virus strain spreading from person to person. Symptoms may appear in as few as 2 days or as long as 14 days after exposure to the virus. Social distancing is key to COVID-19 prevention. Social distancing is defined as maintaining a distance of 6 feet or 2 meters or more between people. Social distancing helps to limit close contact with people that could possibly be sick. Close contact with an infected person is the most common way that COVID-19 spreads. Close contact is when people are less than 6 feet or 2 meters apart from each other. Exposure time is the period of time people are in close contact. Exposure time is 15 minutes or longer. So to help reduce the potential for transmission of COVID-19, practice social distancing, avoid close contact, and limit exposure time to 15 minutes or less. Safe Start guidelines require food establishments to have safety measures in place before they open to the public. So let's take a look at these guidelines. There are 3 important steps in preparing to operate under Safe Start. 1. Develop a COVID-19 safety plan. 2. Educate your staff. And 3. Take action. A COVID-19 safety plan includes the following: staff screening, face coverings, social distancing, reduced seating capacity, cleaning and sanitation, and contact tracing. You can find a COVID-19 safety plan template at the website listed on the screen. Screen your staff for COVID-19 related symptoms at the beginning of each shift. Ask if they have had any of the following symptoms: cough, fever, chills, shortness of breath, headache, sore throat, or recent loss of taste or smell. If they do report these symptoms, or if they have had a close contact with someone they know who has been diagnosed with COVID-19, send them home. King County has already prepared a screening tool template for you. Just visit this website and download the tool. Hand washing is always one of the best actions you can take to help slow the spread of COVID-19. The steps for proper hand washing are: wet your hands. Be sure the water is at least 100 degrees Fahrenheit. Apply soap. Scrub your hands for 10 to 15 seconds. Thoroughly rinse your hands, and then dry your hands with a paper towel or an air dryer. Success! Talk with your staff about social distancing. Staff must socially distance while working, so please encourage your staff to be aware of their surroundings at all times. Face coverings are required for food employees during working hours. Provide face coverings for your staff and ensure they are being worn properly. The covering must cover both the nose and the mouth at the same time. If you are working alone, you don't have to wear a mask. Unless, of course, you're serving a customer. Then your mask is required. For the safety of your staff and patrons, Do the following. Provide one server per table. Limit each table to 6 people. And of course, it is always good practice to wash hands or use hand sanitizer between serving different parties. Social distancing requirements applies to outdoor dining. Only 6 people per table is allowed. Patrons must maintain at least 6 feet or 2 meters distance while waiting in the lobby, lining up to make an order, or to pay for their meal. So be sure to encourage this practice. And for everyone's safety, require patrons to wear face coverings while visiting your establishment. Face coverings are not required while eating. However, patrons should wear their face coverings while waiting to be seated, going to the restroom, or leaving the establishment. Now let's talk about the physical distancing of booths and tables. For the dining area, arrange tables and chairs so that patrons, when seated, are at least 6 feet, 2 meters apart. If you have booths at your establishment, they must be spaced 6 feet, 2 meters apart. Or every other booth can be used. If the booths are very close together and unable to be moved, you can put a barrier in between them as shown. The barrier should be made of easily cleanable material, such as a hard plastic or plexiglass. However, please note that this option is applicable only after physical distancing and reduced capacity requirements have been attempted. Reduced seating capacity is required. The interior seating capacity is limited to 50% of the building occupancy rate. During Phase 2-3, seating at the bar, live music, karaoke, and parlor games such as billiards, darts, and pinball are not allowed at this time. However, food or drinks normally served from the bars may be served at tables or sold. And while bar seating is not allowed, counter seating is okay as long as social distancing requirements are met. As part of the requirements for operating, establishments need to have a contact tracing system in place to maintain patron contact information. Contact information includes the patron's name, phone number, and email. This information must be kept by the food establishment for 30 days and be provided to the health department if asked. Contact information can be destroyed after 30 days. Providing contact information by the patron is voluntary. If the contact information is provided, only one person per party needs to provide this information. So to review, for contact tracing, the food establishment must have a system to collect contact information. Remember, it's voluntary for the patron to provide it, and only one person per group needs to provide their information. COVID-19 has brought a few changes to the daily task of cleaning, sanitizing, and disinfecting. Here's what you need to know. Clean and sanitize the kitchen as usual. Cleaning and sanitizing for the kitchen and all food contact surfaces remains the same as before. Wash, rinse, sanitize, and air dry. If you are using bleach to make sanitizer, use a mixture of 1 teaspoon bleach to 1 gallon of cool water. Otherwise, use any EPA-approved sanitizer for food contact surfaces and mix according to the manufacturer's recommendations. Sanitize tabletops, menus, salt and pepper shakers, and other condiment containers after each use. At this time, it is important to dedicate additional attention to reducing the potential for COVID-19 transmission by disinfecting high-touch areas with an EPA-approved disinfectant or with a properly mixed bleach water solution. If using bleach water to make a disinfectant, use a mixture of 1/3 cup bleach to 1 gallon of cool water. High-touch areas need to be disinfected hourly, or as based on use. High-touch surfaces include, but are not limited to, door handles, pins, faucet and toilet handles, points of sale machines, vending machines, beverage dispensers, reception desks, grocery carts, and high-touch areas of the restroom. For additional information on how to clean and disinfect for COVID-19, follow the link on the screen. And don't forget to wash your hands thoroughly after handling chemicals. Grocery stores are required to replace utensils for salad bars and buffets hourly, as well as to offer hand sanitizer at these stations. Educate staff on how to prevent COVID-19 transmission in your food establishment. We live in a very culturally diverse county, so when educating staff about COVID-19, be sure to educate staff using the language they understand best. And just a quick reminder about visiting this webpage to help you in developing your COVID-19 safety plan. Now that you have learned about your responsibility for COVID-19 and its prevention in your establishment, and you have educated your staff, all that is left to do is to take action. So what are you supposed to do if an employee has COVID-19 or has been exposed to someone who has tested positive for COVID-19? Well, that is a big question, and King County Public Health can help. King County's website offers the most up-to-date information in many of the most commonly spoken languages in King County. But for this presentation, here's what you can do immediately. If one of your employees is sick or tells you they have been exposed to someone who has tested positive for COVID-19, immediately send the employee home. Encourage the employee to see a doctor and get tested. If the employee tests positive for COVID-19, they should remain home under isolation for 10 days after symptoms began and for 24 hours after fever is gone and symptoms get better, whichever is longer. Any staff that has been in close contact with a COVID-19 positive person, but who are not presently sick, should quarantine themselves and not go to work for 14 days since their last close contact with the sick person. If you think COVID-19 is spreading at your food establishment, please contact King County at 206-296-1608 within 24 hours. You can find more information on workplace reporting and free COVID-19 testing in King County at these websites. For additional information on COVID-19 and how it may affect your establishment, please check out these websites for some great resources and posters. Public Health Seattle-King County wishes to thank you for your time and attention during this presentation. We wish you the greatest success during this unprecedented time. Thank you.